More men with early prostate cancer are choosing to avoid treatment. Seemingly overnight, treatment of men with early-stage prostate cancer has undergone a sea change. 5 years ago, nearly all opted for surgery or radiation. Now, nearly half are choosing no treatment at all. The approach is called active surveillance. It means their cancers are left alone but regularly monitored to be sure they are not growing. Just 10% to 15% of early-stage prostate cancer patients were being treated by active surveillance several years ago. Now, national data from 3 independent sources consistently finds that 40% to 50% of them are making that choice. In recent years, major research organizations have begun to recommend active surveillance, which for years had been promoted mostly by academic urologists in major medical centers, but not by urologists in private practice, who treat most men. In 2011, the National Institutes of Health held a consensus conference that concluded that it should be the preferred course for men with small and innocuous-looking tumors. Last year, the American Society of Clinical Oncology issued guidelines with the same advice. The data includes a large new national registry established by the American Urological Association involving 15,000 men, nearly all treated by urologists in private practice through 2015, a national registry of 45 mostly private urology practices, and a Michigan registry of mostly private urology practices. In addition, preliminary 2016 data from the Urology Association indicates that the numbers are growing, with even more than 50% of patients choosing active surveillance. Things are changing very, very quickly, said Dr. Matthew R. Cooperberg, a urologist and epidemiologist at the University of California, San Francisco, who has been helping collect data for the new American Urological Association database. Half of all men with newly diagnosed prostate cancer have low-risk tumors, which pathologists, using a scoring system that looks at the appearance of cells under a microscope, rate as Gleason 6 or less on a commonly used scale. Their risk of dying from prostate cancer in the next 10 years is less than 1%, whether they have aggressive treatment or whether they choose active surveillance, research shows. Nothing, though, is straightforward in the cancer world. Is everyone with a cancer scored as Gleason 6 or lower a candidate for active surveillance? It is not clear. Continue reading the main story. Related coverage. Early prostate cancer cases fall along with screening November 17, 2015. Well. Questioning surgery for early prostate cancer July 18, 2012. Well. New diagnostic tools for prostate cancer December 21, 2015. The new old age. Older men are still being overtested for prostate cancer May 23, 2016. It's not cancer, doctors reclassify a thyroid tumor April 14, 2016. It is an easier decision for older men with a life expectancy of 10 to 15 years because most prostate cancers that grow do so very slowly. But what about men in their 50s or early 60s? These men will need to have regular biopsies for long periods of time so doctors can look for signs their cancer might be growing. Biopsies, though, can result in infections that can be serious and can miss more aggressive cancers because they examine only tiny snippets of the prostate.